Hi, everybody. So, wanted to touch base about the flu because starting to see a lot of flu pick up in the last few weeks. So, mainly flu A right now. There's not a huge difference, as far as A versus B, but we're seeing A right now. So, symptoms wise, is what we're seeing fever, and fever can be high, especially if you have not had your flu shot. So we're seeing 103s, 104s. Obviously with the flu you can get muscle aches, so your whole body kind of hurts, headache and coughing. You can have runny nose and congestion, but it's not like a huge faucet of snot the way that RSV is. And the cough can, it can be very chesty. And so for the flu, you feel pretty rotten. And that fever can last days. Again, if you're not vaccinated, that fever can last, a full week. So with the flu symptoms, we're looking at 7 to 10 days of feeling pretty ill. And what we really want to make sure we're monitoring for is that breathing is not labored, you're not short of breath, you're not having chest pain. And by chest pain, I don't mean like, oh, it hurts like when I'm coughing. I mean like more that it hurts with breaths, like it's hurting when I'm breathing. And for kids, what you're looking for is that they aren't using their bodies to help them breathe. So like that I'm using, muscles in between my rib cage, maybe using their stomachs to help them breathe. That's sort of what you're looking for. So as for treatment for the flu, yes, of course, there are medications available, antiviral medications for young children. Tamiflu is really the only available medication that's approved. We try to only use those for kids that are in the high needs or specialized categories because it can make you ill. I've seen plenty of kids vomit, even my own, from taking it, and it also can make kids hallucinate. So I really only reserve it for my high-risk patients or for those children that are very young. So if you're pretty healthy and you're not in that high-risk category, then probably not going to be offered Tamiflu, or if you are offered it, you might think twice about taking it. Of course, if there are high-risk factors, you're an asthmatic, heart disease as far as congenital heart problems, or you have immune problems, that might be something to consider when thinking about Tamiflu. It has to be started within the first 48 hours of symptoms though, okay? Hydration is important. Obviously, we don't want you getting dehydrated, and fever can help make you dehydrated. And if you have excessive pain in, say, your lower extremities, like as far as like muscle cramping, you need to let your doctor know. That's another thing that we want to know about. This is why we're so adamant that you need to get your flu shot, because it will lessen the severity of symptoms. It will keep you out of the hospital, and it will decrease the chances of anything severe happening to you, okay? All right, that's my spiel on the flu. Sorry about the sun in my face.